If you're pregnant or planning to become pregnant and wondering, can I still use this retinol or is my vitamin C serum safe? What about pimple patches? Well, you're not alone. As a board certified dermatologist who's been in private practice for over 11 years and a mom currently pregnant with my second child, I have been staying on top of the latest research around skincare safety during pregnancy, what's safe, what's questionable, and what is best to pause for now. This video is your science-backed, pregnancy-safe, very comprehensive skincare guide. So let's break it all down together. Part 1, why skincare matters during pregnancy. Pregnancy isn't just a huge hormonal roller coaster ride mentally. Your skin is feeling all of those changes too. So you might suddenly have dry patches, melasma, or acne, or your skin might just feel more sensitive, red, or oily than usual. And here's why all these changes matter. What you apply to your skin doesn't just stay on the surface. Some ingredients can be absorbed into your bloodstream, which is why we want to be not fearful, more thoughtful about what we use during pregnancy. Today, I am giving you the dermatologist backed cheat sheet, what you can safely use, what to avoid, and how to treat common skin issues like acne or melasma. We get so many questions about those. How you can treat all those during pregnancy. Part 2. The safe list. So let's start with the good news. What's actually safe to use? There's a lot, actually, a lot more than we think. Azelaic acid is honestly one of my favorite pregnancy ingredients. I think it's a superstar. It can help with acne, rosacea, hyperpigmentation, like in melasma, and is FDA category B, which means it's shown to be safe in pregnancy. Now, I'm gonna step back a little bit. The FDA category, like the whole lettering system, A, B, C, D, and X, that has since been replaced by safe or not safe. So just letting you know, the category system has changed, but when I was training, we were training with all the letter systems, so I'm just used to that whole categorization. But honestly, it's really safe or not safe / we need more studies, or it's like a gray area. Niacinamide is one of those other go-to ingredients for me during pregnancy. It can calm inflammation, it can support the skin barrier, it can help with redness, it can help brighten the skin. It's a form of vitamin B3. It's very well tolerated. I would say 5% or less. Vitamin C is also another favorite. It's great for glow, brightening, and of course, antioxidant protection. It's safe topically and a great way to support collagen during pregnancy because we cannot use retinol. Hyaluronic acid is deeply hydrating. It's safe for pregnancy. It doesn't penetrate deep into the body, so we don't have to worry about that. Another thing about hyaluronic acid, so it's already in a ton of moisturizers. I don't think hyaluronic acid is anything special, but I feel like for marketing purposes, it's become super popular. But I do recommend that for stretch marks on your abdomen. I think it's something that we do have some preliminary mild data for. But yeah, it's gonna add some hydration. We're gonna get dry during pregnancy. You wanna like soften those lines. I mean, I definitely noticed my wrinkles becoming way more prominent, so I need all the help that I can get to plump my skin and soften those fine lines. Zinc oxide and titanium dioxide are the two mineral sunscreen ingredients that I recommend. They sit on top of the skin and aren't absorbed as much as the chemical sunscreens, so these are safe and essential for melasma prevention. Now we know that there's also chemical sunscreen ingredients too, and honestly, we haven't seen any studies where it is problematic during pregnancy, so if you like it, continue to use it, but we do have data to show that it does enter the bloodstream, and in terms of to what degree that can affect the fetus, we don't truly know. Like I said, it hasn't really been a huge problem, but this is like if you want to be super, super safe. Because basically what I'm getting at is like recommending ingredients that we know have a low absorption capacity, as well as those that have been proven in studies to not cause any harm. What about peptides and ceramides? We love these. They can help maintain a healthy skin barrier and are perfect if your skin feels dry, itchy, or more sensitive than usual. And if you're dealing with hormonal breakouts or pigmentation, like I said, we like azelaic acid, niacinamide. Those are probably going to be your two new best friends. I also like low strength glycolic acid. We tell people to kind of keep it under 10%, but that might be coming up in our next section, which is the maybe zone. Part 3 is the maybe zone. So now let's talk about the gray area. These are ingredients that aren't strictly banned, but should be used cautiously. So benzoyl peroxide is a powerful acne treatment in concentrations under 5%. Short-term use is likely safe, but I still recommend checking with your OBGYN before using it regularly. Now, interestingly, benzoyl peroxide is on the okay to use list according to the ACOG, the American College of Obstetrics and Gynecology website. So take it how you will. It used to be like category C back when we were using that system. And so that's why I would tell patients, make sure that it's, I would just say like under 5%. maybe just stick with like a cleanser form, or if you're using it on your face, just like use a very small amount as like a spot treatment, not like all over your face or all over your back. Salicylic acid is another one. It's a beta hydroxy acid that exfoliates, it unclogs pores. We love it for blackheads and acne. We say small amounts, so 2% or less in a cleanser is fine. I would just avoid like high strength salicylic acid peels or leave-on products unless you've cleared it with your provider. The main thing I would say to avoid is like those high strength salicylic acid peels, which you probably aren't getting anyway, so you should be okay. Then we have the alpha hydroxy acids like lactic acid and glycolic acid. These can help with dullness, pigmentation, acne to some degree, texture, and these are generally safe in low to moderate concentrations. I would just, once again, skip those higher strength chemical peels or professional grade products where, yeah, it's similar to like a chemical peel. Then there's skin lightening ingredients, where this also is a gray zone, but are probably safe. These ingredients are like alpha-arbutin, kojic acid, licorice root. These are more gentle alternatives to hydroquinone for pigmentation. So something that you may want to consider, definitely talk to your derm and your OBGYN. Then there's also essential oils, which are a little tricky because some are fine, but others like sage or rosemary can actually potentially stimulate uterine contractions. So unless they've been specifically clear, I think it's best to avoid like essential oil heavy products during pregnancy. So yeah, basically this group of ingredients falls into talk to your doctor first zone. So if your skin's flaring, don't panic, just be intentional and make sure that you're supported with your OB and hopefully a derm. Part 4, the no-go list. Now, these are the ingredients I recommend avoiding altogether during pregnancy. First are retinoids. So these even include over-the-counter retinol. But prescription forms like tretinoin, tazarotene, and of course isotretinoin or Accutane have been linked to birth defects. And these should absolutely be avoided. The next one is hydroquinone. Now, this one's often used to lighten pigment. It works so well, but it has a high absorption rate and limited safety data, so it's best to hold off until after you're done breastfeeding. And like I mentioned before, we don't like strong chemical peels when you're pregnant, like those with trichloroacetic acid or TCA peels or phenol peels. These are too harsh and can increase inflammation and sensitivity. And then also, higher strength lactic acid, glycolic acid peels. Procedures like Botox and fillers haven't been studied enough in pregnancy, so most dermatologists, myself included, recommend waiting until postpartum to get those done. I know it can be really hard to give up your retinol or your brightening products, but this is temporary. Remember that. And there are safe swaps that can get you through it. Speaking of procedures, I also recommend holding off on lasers. We just don't have enough data to support the safety of it. And usually it's an elective procedure, it's cosmetic, so just wait. Same with microneedling and, ultrasound, radio frequency, those other in-office procedures. Part 5, building a safe routine. Now let's build a simple, effective routine using pregnancy-safe products. So in the morning, you want to start with a gentle cleanser, and then you want to follow that with a vitamin C serum. And then layer on a moisturizer with niacinamide and or hyaluronic acid. And then you're gonna finish that with a mineral sunscreen, SPF 30 or higher. We also like tinted sunscreens because those further help prevent worsening of pigmentation in the skin. So in the evening, you wanna start with cleansing. I'm a big fan of the double cleanse method, where you first cleanse with some kind of makeup remover like micellar water, or an oil-based products will do better binding to your makeup and your sunscreen to really ensure that it's off your face. And then you wanna follow that with a gentle, usually like a water-based cleanser or a gel-based cleanser. Then the next step is when you want to apply like your actives that are safe. So these include azelaic acid, peptides, bakuchiol. I didn't mention bakuchiol earlier. So bakuchiol is something that you can look into if you want sort of a retinol alternative. It by no means, I don't think it replaces a retinol or tretinoin in your Retin-A, but it does have like collagen stimulating effects and hence can help with collagen production and smoothing fine lines and wrinkles. So that's what I use. I use bakuchiol serum because I need something. So after you're doing your active step, then you're gonna follow with a hydrating moisturizer, like I said, with hyaluronic acid and or niacinamide, which many moisturizers will have. This routine supports your skin with ingredients that are anti-inflammatory, antioxidant rich, and hydrating, all while being safe for you and your baby. Part 6, common pregnancy skin issues and how to treat them. So let's get into some of the most common skin conditions that I see in pregnancy and how to treat them safely. The first one is acne. So common. But you do not have to suffer through pregnancy with acne. I love azelaic acid or glycolic acid products. Like I said, benzoyl peroxide under 5% may be okay, as well as 2% or less of salicylic acid. I also forgot to mention LED light. So there's blue light therapy that can also help reduce inflammation without using any active ingredients. I don't think blue light alone is gonna be miraculous, but it's just more of a supportive treatment along with your other skincare. It can be expensive. So like I said, don't rush to it, but something that's helpful and safe. What about about melasma, aka the mask of pregnancy? Honestly, melasma can show up as brown patches anywhere on the face. Very annoying. It can also show up as just like super increased freckling, which is what happens with me. So super common. It's driven by hormones and sun exposure. Like I mentioned earlier, use a mineral sunscreen that's ideally tinted. Use it every single morning, even if you're not going outside, okay? Every day. If you want to brighten your skin, stick with things like azelaic acid, niacinamide, vitamin C. Topical tranexamic acid may also help, but you want to talk to your doctor first. Other ingredients, kojic acid, alpha-arbutin, licorice root. I love these as skin lightening ingredients, and they are likely fine during pregnancy. Once again, just run it by your doctor. And remember, we can treat more aggressively once you're done with pregnancy and breastfeeding. I know I'm sharing a lot of different ingredients and a lot of different steps, but I will share all my favorite products that I personally use during pregnancy that I think are helpful for specific conditions, whether it's acne or hyperpigmentation. I'm going to share that in some links in the description box below. Part 7, rapid fire FAQs. Can I get facials during pregnancy? Yes, but like I said, avoid strong chemical peels or treatments with retinoids and stick to hydrating and calming facials. Like facial steaming and using mechanical methods to unclog your pores are okay. What about microneedling or lasers? Like I mentioned earlier, we want to skip them for now. We can revisit them once you've delivered. I also forgot to mention that these procedures, a lot of in-office procedures require numbing cream, and that's not safe during pregnancy. So just wait. You can wait. Are pimple patches safe? Yes. Now, these are the hydrocolloid patches. If they're just pure hydrocolloid patches, they're drug-free, those are perfectly safe. There are some patches that are like infused with salicylic acid or niacinamide, and those are likely fine as well. So remember that pregnancy doesn't mean that you have to press pause on skincare. You just have to shift your approach, be very mindful of your skincare. And if you're like me, if you're juggling hormonal shifts and skincare goals, know that it is possible to take care of your skin with science, safety, and self-love, and just a healthy dose of Dr. Mamina YouTube videos. Like I said, I've linked my favorite pregnancy safe pics and relevant studies in the description box below. If this video helped you, please give it a like, or if you know someone who's pregnant, please share it with them. And please let me know your favorite pregnancy safe product in the comments below. I always want to learn more about what people are using. Thank you so much for watching, and I will see you in the next one.